Welcome to our media conference. We are the London West Girls Government, and we are here to talk about youth suicide. My name is Iman Tanvir, and I'm a grade 8 student at Clara Brenton Public School.
My name is Sarah Enns, and I am also a grade 8 student at Clara Brenton. In Girls Government, we have been working with MPP Peggy Sattler since early November 2017.
My name is Venus Osmani, and I'm also a grade 8 student from Clara Brenton Public School. As a group in Girls Government, we decided to focus our attention on youth suicide and methods to prevent this issue from spreading. We believe that the youth suicide prevention was a worthy topic to discuss due to the fact that we all had a family member, friend, or a loved one that has been deeply affected by the risks involving suicide. This topic has drastically affected each and every one of us a part of Girls Government. Therefore, we believe that focusing on the risks that suicide brings should be taken more seriously and that changes involving education and mental health should be made to help prevent this issue.
My name is Amber Pridle, and I'm also a grade 8 student at Clara Brenton Public School. Once we chose this topic, we met with 4 guest speakers. In my understanding, first episode Moon and Anxiety Program, Western University Child and Youth Development Clinic, and Youth Opportunities Unlimited.
My name is Olivia Flores, and I am a grade 8 student at St. Paul Catholic Elementary School. As a part of this group, each of us did our own research and used that information to write letters to the editors and letters to the ministers of health and long-term care and education. We also developed a petition and collected signatures.
We are recommending that the Ontario government implement a comprehensive strategy for reducing child and youth suicide.
The strategy should involve the Ministries of Education, Health and Long-Term Care, Children and Youth Services, and any other relevant ministries that should be developed in close coordination with community suicide prevention planning.
My name is Adria Giosa, and I am a grade 8 student at St. Paul Catholic School.
And my name is Kennedy Knock, and I'm also a grade 8 student at St. Paul Catholic School.
We are greatly concerned about the growing problem of youth suicide. Mental illness is a large contributor to suicide. 73% of teachers agree that anxiety disorders among students are a pressing concern. 1 in 10 Ontario students in grade 7 through 12 reported seriously considering suicide, and about 3% reported attempting suicide.
We believe that we should make mental health curriculum mandatory for all grades, beginning with social-emotional learning for primary students, mental health promotion for grades 4 to 6, suicide prevention and awareness for grades 7 and above, and suicide-aware training for secondary school students.
In order to do this, we need to provide funding to develop age-appropriate, evidence-based curriculum resources, provide funding to support teacher professional development on the new mental health curriculum, and incorporate mental health training into teacher education programs delivered by Ontario faculties of education. It is important that teachers have the proper resources to teach their students about mental health effectively. It is also crucial that teachers are educated about what they are teaching their students.
We think that another effective way of teaching students about mental health is through school assemblies with guest speakers. That is why we should provide funding for schools to bring in approved guest speakers on mental health and suicide prevention, and provide funding for local agencies to make staff available as school guest speakers.
Just like math, it is crucial that we start implementing mental health coping strategies and how to be suicide aware in students' minds at a young age. If we can recognize the signs of suicide, then we can even possibly save a life.
Throughout Ontario, 17% of children ages 2 to 5 years meet diagnostic criteria for mental health problems, along with 76% of families recorded not knowing where to seek help regarding their child's mental health. Our proposition is to support family-focused, school-based programs to help parents and guardians deal with their child's anxiety, identify early signs, and reduce stigma.
We believe that having the youth of our society understand the cause of mental health disorders will help them cope with their difficulties involving mental health. Organizations such as MI Understanding have been educating children of a young age regarding the LGBTQ+ community and how to show respect or feel comfortable learning about the topic. Also, lack of sleep is proven to cause various mental health disorders and also cause stress. Youth who don't get adequate sleep are at a higher risk of developing mental health illnesses such as depression.
This statement leads us to believe that secondary schools should implement later start times to allow students to obtain more sleep to prevent issues caused by mental health illnesses. Insufficient sleep reduces academic achievements, school attendance, increases mental health issues, and weight gain. 1,430 people die each year in Canada due to drinking and driving, yet 3,500 people die by suicide per year in Canada. However, drinking and driving advertisements are shown more frequently compared to suicide prevention.
Due to this statistic, our proposition is to create live and social media-based programs informing the youth about the risk involving suicide, including websites, advertisements, and radio conferences.
Incorporating youth suicide awareness onto social media-based platforms will educate our society regarding this subject because the majority of our community has access to social media sites.
We think that the Government of Ontario needs to provide funding for schools to hire more social workers, counselors, psychologists, therapists, or other mental health professionals. There is a chronic shortage of pediatric psychiatric services. Currently, there are fewer than 100 child and youth psychiatrists for the entire province of Ontario. Child and youth psychiatrists are under a ton of pressure, not just because of the limited number, but also because between 2006 and 2014, there was a 43% spike in the number of children and youth in need of psychiatrists. To overcome the financial barrier, we think that the Government of Ontario should provide OHIP funding for psychotherapy delivered by non-physicians. Several families in Ontario can't afford for their child to see child and youth psychiatrists even though they need to. This creates a problem and leads to more deaths by suicide due to the fact that the children and their families can't afford to see help. If psychotherapy is provided by OHIP, this will increase the number of children and youth seeing doctors and minimize the number of deaths by suicide each year.
According to CMH, Children's Mental Health Ontario, more than 12,000 children and youth in Ontario are currently waiting to access mental health services. This is unacceptable and needs to be remedied. After further research and talking to guest speakers from First Episode Mood and Anxiety Program and MI Understanding, we have learned that waitlists are out of control and can vary from 3 to 18 months.
Tragically, some youth will die by suicide waiting for treatment. This is due to the lack of funding for mental health community services for youth. We are asking the government to increase funding to eliminate these waitlists for youth mental health community services.
Early in January, Osta AECO student platform came out with some student well-being recommendations. We agree with their ideas and stated in the document. In several of the recommendations, they stated that everyone, especially students and teachers, should receive training in order to be able to help if someone they know is having suicidal thoughts and is in need.
The Osta AECO student survey showed that nearly half of students didn't feel prepared to help a peer with a mental health issue. The 2015 Ontario Student Drug Use and Health Survey stated that 28% of students didn't know who to talk to when they needed help with a mental health-related problem. We are asking the government to consider and integrate the recommendations made by Osta AECO student platform. Any questions?
Question. Thank you for your great recommendations. Was there anyone, you spoke about guest speakers that you met with, was there any one guest speaker or meeting that really stood out that helped you develop your recommendations?
I think the guest speaker from FEMAP stood out to me because she really talked about all the wait lists and how the amount of psychologists and stuff they have.
What is FEMAP? Can you tell us a bit more about that?
It's a program called First Episode Mood and Anxiety Program, and they help out with people who are having suicidal thoughts or are struggling and they need someone to talk to.
I have a question. So you girls are all in grade 8, is that right?
Yes.
And so from the time that you started school, do you feel that you have had any exposure to curriculum on mental health and well-being?
For our school, I came to Claire Brenton in grade 6. In grade 6, 7, and 8, we haven't discussed mental health whatsoever.
The same with our school, St. Paul.
Yeah, since kindergarten, nobody's really talked about mental health.
So what you know about mental health is just from the research you've done for this program? Yeah, okay. Okay, any other questions? Janine?
Okay, so I understand that there were several topics that you had debated choosing before you chose youth mental health and suicide prevention. So can you just give us briefly an overview of the other issues you were also interested in?
I think we had homelessness, gender stereotypes, and some animal rights.
Mm-hmm. Yes.
And Amber?
First, funding for students with autism.
Okay, and what ended up being the reason that you chose the youth suicide prevention issue?
We thought that all of the topics that we chose kind of fit into suicide prevention in youth and this one category.
And all of us have been touched by
Yeah.
mental health or
Mhm.
suicide in some way, so.
It's great to see such young girls getting involved in such an issue that's so important to the province and the whole country. What encouraged you to get involved with the London Girls government and just this issue? How it's clear that you feel very passionate about it, but can you maybe just speak to the importance of being involved and speaking at the provincial level on this issue?
Well, I didn't really know that much about the government, but it really does feel good to feel like you're making a difference in your community.
Anybody else like to respond to that one?
I think it was the same for me as well. I didn't know much about the government, but I still really wanted to get involved because I thought it would be a really great experience. And now that I'm involved with it, I'm really happy that I took the chance because it's been amazing.
I do have a question. How do you girls think you're going to take this issue forward in the future?
I think continuing to raise awareness and doing whatever we can in that area, like talking to newspapers and doing more interviews, will help spread awareness and just have people talking about it, and then the government will hear about it more and try to do something about it.
In the meetings that you've had today, you've met with a couple of MPPs and you've spoken to a number of cabinet ministers. You sat down with Minister Couteau just now and talked to him. Do you feel encouraged by the response that you've received? Do you feel that there will be some changes coming forward?
I believe that we definitely feel encouraged by it because they agree with our proposals about the curriculum and that they also want to make a difference with the ideas that we also created.
Anybody else on that one?
Yeah, and we met with Jeff Yorick earlier, and he said he's going to a meeting and he's going to bring our paper with him and just let everyone know what we're doing and what we're doing it for.
Sure.
So tomorrow is International Women's Day, and in addition to learning about mental health, what have you guys learned around girls in government or women's rights in general?
We kind of learned, because Peggy kind of talked about it, that there aren't that many women involved in politics because we went to question period today and it's kind of aggressive. And we think that might be a barrier, that why there's not as many women.
Yeah, and the speaker has always been a male. There hasn't been any females in the history of the legislature.
So based on what you've done through Girls Government and your experience today, do any of you feel like you can see yourself as future MPPs?
I think maybe.
Yeah, maybe.
Anybody else want to respond to that?
Yeah, it's like a lot more interesting because before I never really was interested in the government, but like through this program, I've been really interested in like learning about the government and what happens in the legislature.
I think just coming here, it really changed my perspective. So.
Okay, anybody else? Okay, I think we're done.